the next food you eat decides whether your body heals or slowly breaks down. Imagine this. A father sits down at dinner with her children. He smiles, he laughs, he feels fine. Everything is going quite okay. But inside his body, sugar is rising, blood vessels are getting damaged progressively. His kidneys, his eyes, his heart are quietly under attack. No pain, no warning. Then one day there is blurring of his vision and seeing is becoming impossible. Then he realizes something is not going on right. Then his kidneys are failing and all of a sudden a stroke happens. This changes everything and his life comes and takes a new dimension. This is diabetes, a silent disease that is slowly destroying life, one at a time, progressively, and in very dangerous way. In this live webinar, we are talking about how to beat diabetes naturally, because science has proved that this is possible and it can be done. Right now, many people are walking around, feeling okay, going about their daily business. Nothing big, nothing tragic, everything is happening at a normal pace. But inside, the sugar is too high. You may not feel it. Sometimes you have that natural tiredness. Your day, you feel it is overwhelming. You may have some fogginess, but nothing to think that there are serious things happening in your body. But slowly, your organs are getting damaged, your energy is dropping, and your life is getting shorter without nothing that is conspicuous. Then the hardest truth hits. Most people only act when it is too late, when damage has been done in various organs of your body. Your eyes have been affected, so your vision is becoming impaired. Your brain is getting affected. The blood vessels taking blood to your brain are narrowing progressively. The blood supply to your heart is getting progressively compromised. Your kidneys are getting progressively affected, and your capacity to retain protein in your body through your kidneys is becoming poorer, and you start passing some of that protein in your urine. Nothing dramatic, nothing that you can notice, nothing that you can talk about. And then even the blood vessels in your legs are getting progressively affected. Your feet start becoming numb, they are more sensitive to pain, and they are losing also sensitivity. And when you get wounds on the legs, it take longer to heal. So that is the silent damage that is getting done to you. And when people decide to act, treatment is expensive, treatment is difficult, and life becomes very painful. I'm very sure that many of you who are watching this live, who are also going to watch this video, that is not the kind of life that you want. You want more control, you want to be in charge, and you want to take control of your future, whereby you live a life that you are able to control what is happening to you, and you are in charge. So keep watching, because I will reveal more truth of simple things that you can be able to do on a daily basis and take control over your health and manage diabetes using simple things that you can do on a daily basis. Type 2 diabetes, science has shown that it is not always permanent. Science has shown that your body can heal, your sugar can calm down, and even some people can be able to get into remission, especially when complications have not set in. What a breakthrough. And what good news this evening that you are here. This is not magic. It is not expensive drugs. It is your lifestyle. How you live and how you do things on a daily basis. We are talking about food. We are talking about movement. We are talking about daily habits. Think about it. Let me make it simple. When you eat too much of the processed food, when you move too little, then fat starts building inside your body, and it builds around your liver, it builds around your pancreas. This makes it difficult for the islet cells in your pancreas to produce adequate insulin to take care of your metabolic needs, and your cell's capacity to respond to insulin becomes poorer. And this then blocks the response to insulin. Then sugar stays high in your bloodstream, and then your body cannot be able to access it. And then inflammatory processes that are damaging to organs, to your tissues, to your cells start to happen. You have gotten into the diabetic phase. But this does not have to be the case. When you change your lifestyle, you decide to lose weight, and we talk about losing between 5 to 10% of your body weight. You reduce the fats around your organs, and especially the belly fat. Then insulin starts working again. What a relief. Because this can happen to you if you decide to change your lifestyle. So stay with me. Let's keep discussing. And if you have any question, you can drop it on the comments section of this video presentation. So your body will start to heal again because it has learned that we are healing and things have changed. So what are the 3 key ways to beat diabetes naturally? 1, we talk of food as medicine. When I talk about eating real food, try as much as possible to eat real food. When I talk about real food, make your food more plant-based. Make it more whole grains. We are talking about the natural flours, not the sifted ones. If you are taking ugali, then it is the maize meal that has just been ground, not the sifted flours. When you're talking about wheat flour, not the sifted flour. We are talking about just the natural whole meal wheat flour. When you talk of maize, we are talking about the githeri, the natural maize whole meal, the way it is. So get your protein, most of them, mostly from plants, because this is able to sustain your metabolism, controlling your sugar, controlling your metabolism for long. Then make sure that your food has plenty of vegetables. Initially, when you are starting this process, you need to eat small amount of fruits in controlled ways. But as you continue to control your sugar, you can increase your fruit intake as you control the oxidative processes that are happening in your body. Then ensure that you have healthy fats, little adequate amount of the natural healthy fats, and then make your meals whole meal. When we talk about the natural plate, the plate method of controlling what you eat, then there you ensure that half of your meal, of your plate, is vegetables. A quarter of it is more of the plant-based proteins or the lean proteins or the lean meats, and then ensure that you have the good types of fats, the olive oil, the avocado oil that are healthy, adequate amount, and of course make sure that you reduce the sugary drinks that you take on a daily basis. So you reduce the sugar, remove the refined carbohydrates, remove the processed foods, and what you eat daily decides your future. Here, I would also put an adjunct that if you are able to do intermittent fasting, then it will be very good. It helps stabilize your metabolism. But again, you need guidance if you have diabetes, if you have hypertension, if you have any of these chronic diseases. It is important that you consult your health provider. Remember this, what I'm presenting here is for education, for personalized health advice. See your regular health provider so that you are appropriately advised. Then ensure that you are taking adequate amount of fluids, more so of water. If you want personalized guidance on how to go about this, we have the Health Insight 360 program. This is a personalized coaching program that will make you understand these things in a better way, and will hold your hands and work with you so that nothing is complex, but you can be able to incorporate this into your daily life and reverse your diabetes. The next pillar in dealing with diabetes the natural way, movement. When we talk about movement, we are talking about walking, we are talking about stretching, we are talking about staying active. Movement helps your body to use sugar in better ways. So when we are talking about exercise, we are talking about moderate to high intensity exercises. We are not talking about the high intensity exercises, but exercises that you can be able to sustain for 30 minutes. If it is a walk, you are able to walk in a way that you cannot be able to talk on a phone. You cannot be able to sustain a conversation or sing as you exercise. And this you do between 150 to 300 minutes in a week. And then you do the aerobic exercises, which could be walking, could be jogging, could be skipping rope, could be cycling, could be swimming. Do between 150 to 300 minutes in a week. That would mean that you're doing it at least 6 days in a week and resting in 1 day. Then you need to do strength training at least 2 to 3 times in a week for 20 to 30 minutes. Remember, from the age of 30, all of us lose muscle. So you need to build your muscle because muscle helps your body to utilize sugar even without the need for insulin. So muscle helps you to become more efficient. And to avoid things like falls, then you need 2 to 3 days also of flexibility exercises on a daily week. So if you can be able to incorporate this, then you'll be able to master your blood sugar and have a better control of your sugar. Then other important things that you need to do on a daily basis. Manage stress is a daily occurrence due to various happening in our lives. It could be your finances, it could be social stresses, anything that stresses you. How do you manage stress? You cannot wish stress away. Learn to practice gratitude, learn to practice mindfulness, learn to practice meditation, and learn to take walks in the natural environment, all practicing things like yoga. They have been shown to help manage stress. So manage your stress. And exercise is one of the other ways that you can help manage stress. Then ensure adequate restorative sleep. When we are talking about restorative, adequate sleep, we are talking about 7 to 9 hours of good sleep for adults, and for adolescents, we are talking about 9 to 12 hours of uninterrupted night sleep. So it is very important that you get adequate amount of sleep. Of course, remember these habits when you start them. It is not something that you do on a daily basis and then you reach a point you abandon. This is your lifestyle. This is what you should do on a daily basis. You incorporate into your lifestyle. So when I tell people that these things, they can be able to manage them, they can be able to change. When I tell you to join the Health Inside 360 coaching program, I'm not talking about something that you use for 3 months and then you abandon. We are talking about getting a new standard of lifestyle, which is health friendly. Remember, health is not something that you live for a few days and then you abandon. We are talking about your lifelong health. The only way to live healthy is to know that you are a person who is becoming healthy and a person who adopts habits that are helping you live a healthy life on a daily basis. Remember this, if nothing changes, then this is what happens. Blindness sets in, kidney failure sets in, heart attacks happen, strokes happen, early death comes in. And in my 25 years of practice of medicine, I have seen this too often. And that's why I'm talking about. When you have diabetes, if you don't change your lifestyle, you start getting worse progressively. But with your change of lifestyle, you can be able to stop this continuous and progressive damage to your organs. So we are starting to realize that diabetes doesn't have to be a chronic disease. It can change when you decide. If you don't change, then that painful pattern takes in place and it is very painful. It happens slowly and you continuously feel fine, but your body is slowly getting out of touch. So don't wait for the hospital bed. Don't wait to be put on the dialysis bed. Take action today. This is time that you can be able to change and take control of the diabetes. This is the time that you can be able to change and take control over your weight. You do not need anything that is outrageous. Imagine waking up with energy. Imagine your sugar is well controlled. Imagine your body feeling lighter. Imagine having a clearer mind. Imagine living stronger, being there for your family, being there for the family function. No need to visit the hospitals for dialysis. This is possible, and this life is possible. But you have to take a decision, and you have to start seriously with commitment. Information alone will not change your life. Knowledge, when it is not put into action, becomes entertainment. You need a clear plan, you need daily guidance, you need support, and this is where many people fail. So listen very carefully. If you ignore this moment, you may lose your health slowly, because that is what happens. People think I can do it. People think it is simple, but you can change your life. I'm inviting you to join the Health Inside 360 program. This is a doctor-guided program that will help you build lead life. You get simple daily steps, clear food guidance, support to stay consistent, because that is where the time meets the road, and a little path to control your sugar. Not theory, not confusion, real results that you can see for yourself. Call or WhatsApp us on the number that is on the screen, or visit the Wellness Health Services website. Do not wait, do not delay. Your body is changing every day, either towards disease or towards healing. Decide today. Your future is not written in your diagnosis. It is not decided by you having diabetes. It is written by your daily choices. This is your moment. Let's start today. Thank you for watching. If you have any question, you can ask in the comment section of this video. We live stream the webinar, and I will answer all your questions. And if you need guidance, if you need to take control of diabetes in a natural way, then you have it. Thank you for watching. We meet in the next live presentation next time. Thank you for watching.